Assalamualaikum warahmatullahi wabarakatuh and hi. For today, we will going to present about a topic, obesity, a health epidemic for TSLP 1114, language skills in academic context for our continuous assessment task 2 oral presentation. Our group members consist of my friend AMIRUL AZIM bin SUDIN and me myself Muhammad FAHIM Azim bin ARSAT. The contents for our presentation today is the first is introduction to obesity, second, causes of obesity, third, effects of obesity, fourth, solution, and the last one is conclusion. So first, what is obesity? Obesity is a complex disease involving an excessive amount of body fat. Obesity isn't just a cosmetic concern, it is a medical problem that increases the risk of other diseases and health problems such as heart disease, diabetes, high blood pressure, and certain cancers. According to WHO or World Health Organization, obesity and overweight are both described as abnormal or excessive fat buildup that poses a health concern. Overweight is defined as a BMI of 25 or higher, while obesity is defined as a BMI of 35 or higher. Body mass BMI or body mass index is a simple calculation using a person's height and weight. The formula is BMI equals to kg divided by M2, where kg is a person's weight in kilograms divided by M2 is their height in meters square. So, why does obesity is dangerous? Actually, obesity is one of the leading causes of disease and disability across the world. Obese patients are at a high risk of developing a variety of comorbid conditions such as cardiovascular disease, gastrointestinal disorders, type 2 diabetes, joint and muscular disorders, respiratory problems, and psychological problems. According to the Global Burden of Illness, over 4 million people die each year as a result of being overweight or obese in 2017. Obesity was formerly a problem in many impoverished countries, but it is now affecting even middle and low-income countries, such as those in Southeast Asia. According to studies, obesity currently affects more people than starvation. Obesity is caused by a bad diet and a lack of exercise, and always obesity has been linked to mortality and cancer. One of the main causes of overweight and obesity is poor diet, overeating, too much fast food consumptions, high alcohol use, drinking too much sugary drinks, and comfort eating are all examples of poor diet. In the short term, poor nutrition can contribute to the risk of developing some illnesses and other health problems such as high blood pressure, high cholesterol, heart disease and stroke, type 2 diabetes, some cancers, and eating disorders. When wages grow, people become more urban. So, high fiber, complex carbohydrate diets give way to more diversified meals with greater fat, saturated fat, and sugar content. As a result, people consume more calories than they need. Fast food also contains an unhealthy quantity of salt, fat, and even sugar in a single meal, which can contribute to various health issues, and the main is obesity and overweight. Obesity can result from eating more calories than you burn in everyday activity and exercise over time. These additional calories pile up over time, resulting in weight gain. If you ingest a lot of energy at once but don't burn it off, your body will store it as fat. In most cases, eating a lot of sugar and fat in your regular meals will make you gain weight faster.
So, moving on to the next part, which is the effects of obesity. The first effect is death or mortality. Obesity is a truly critical symptom because it carries negative effects to human body and well-being. One of the example is obesity can cause a person to develop a dangerous disease that can lead to death. Heart disease and strokes. Obesity makes you more likely to have high blood pressure and an abnormal cholesterol level, which are risk factors for heart disease and strokes. Second is type 2 diabetes. Obesity can affect the way the body uses insulin to control blood sugar levels. This raises the risk of insulin resistance and diabetes. Certain cancers. Obesity may increase the risk of cancers of the uterus, cervix, endometrium, ovary, breast, and others, which later on will be presented by Fahim, our next presenter. Digestive problems. Obesity increases the likelihood of developing heartburn, gallbladder disease, and liver problems. And the next one is sleep apnea. People with obesity are more likely to have sleep apnea, a potentially serious disorder in which breathing repeatedly stops and starts during sleep. And the next one is osteoarthritis. Obesity increases the stress placed on weight-bearing joints in addition to promoting inflammation within the body. These factors may lead to complications such as osteoarthritis. And the last one is severe COVID-19 symptoms. Obesity increases the risk of developing severe symptoms if you become infected with the virus that causes coronavirus disease 2019 or COVID-19. People who have severe cases of COVID-19 may require treatment in intensive care units or even mechanical assistance to breathe. So all of these diseases forms uh, can lead someone to be more likely to have mortality. So there are a number of studies or researchers regarding this critical disease. One of them is the epidemiology of obesity, which is more detailed and focuses on the overall effects of obesity. According to Hubai and Hugh, 2015 stated and suggested that numerous protected observational studies and three additional major syntheses of data obtained from established cohorts that appropriately taken into account for smoking history and chronic disease status show unequivocally that overweight and obesity are associated with an increased risk of mortality rates, death from side health disease, and being diagnosed to the patient. Based on the statement, implicitly, obesity is not just detrimentally damaging, in this case, mortality and morbidity, but there are also side implications that increase the health burden of patients who suffer this overweight problem. For instances, cardiovascular disease, diabetes, cancer, or accidental death over the life course.
Next, one of the effects of obesity and overweight is cancer. According to Freud 2017, obesity is linked to a variety of malignancies. For example, postmenopausal breast, endometrial, colon, and rectal cancers, gallbladder cancer, prostate cancer, ovarian cancer, endometrial renal cell cancer, pancreatic cancer, and lastly, kidney cancer. So, how exactly being overweight and obesity can cause you cancer? Overweight and obesity can cause changes in the body that help lead to cancer. These changes can include long-lasting inflammation, higher than normal levels of insulin, insulin-like growth factor, and sex hormones. The risk of cancer increases with the more excess weight a person gains and the longer a person is overweight. Extra fat, as well as the metabolically active nature of these extra adipose tissues, has been related to the development of various cancers. Obesity is associated with a wide range of illnesses, which is a significant clinical issue for obese patients. However, as significant as this group of risk factors is for a patient's health, they may be affected positively by weight loss.
So, moving on to the next part, we have covered the introduction or the overview of obesity and the causes and also the effects. Now, we're going to share with you about the solutions of this disease. So every crisis has a solution, and the obesity epidemic is both preventable and reversible. The first step in preventing this condition is to eat a nutritious diet. A healthy person is one who is concerned with his or her nutrition. To prevent obesity, it is recommended that people consume food according to the food pyramid. So, to combat obesity in this global population, a healthy and nutritious food intake should be promoted by adhering to dietary standards such as eating enough fruits, vegetables, fish, and starchy carbohydrates meals while limiting fatty, sugary, and salty foods. This is based on the statement which was said by Kumanyika et al. 2002. So a healthy person is one who is concerned with his or her nutrition. So in simple word, we can say that one should follow the food pyramid as a guide to ensure that they eat what is required and enough for their energy, health, and well-being. So next is someone who is diagnosed as obesity without a doubt should be practicing a nutritious and balanced diet in order for him or her to lose weight. So this phase, which is practicing a balanced diet, will be difficult for people who are overweight or also genetically larger. So they might find it really hard to stick the conservative way of practicing a regular diet, which was done by a lot of regular people nowadays. However, one of the most effective ways to maintain a regular healthy diet while gradually portion size. Furthermore, it is critical to note that energy balance refers to the process by which energy intake from food and drink is balanced with energy production from physical activity. As a result, people should eat in accordance with their daily activities. So, furthermore, the second endeavor or efforts is to participate in physical exercise on a daily basis. So, physical activity is a form of activity that, as any bodily movement produced by skeletal muscles that requires energy expenditure. So, it refers to all movement, including during leisure time for transport to get to and from places or as a part of a person's work. Both moderate and vigorous intensity physical activity can improve our health. So there are numerous of advantages of activities to our health, but most importantly, it can solve the problem of our topic today, which is obesity. Adults who already engage in regular moderate intensity activity should aim for 3 rounds of vigorous intensity activity lasting at least 20 minutes per week, according to Kumanyika et al. 2002. So based on that statement, it is suggested that a person participate in moderately intense exercise such as brisk walking, cycling, jogging, or going to the gym to exercise, hiking, and swimming. It can improve someone efforts on trying to lose weight on their own. So plus you can also do some simple activities such as taking the stairs or sweeping the yard or maybe going to work and so on. So this in turn will transform extra weight into a healthy habit that everyone can do by themselves. So, in a nutshell, obesity should not be taken lightly by everyone. In fact, it is the most vital topic to be discussed among ourselves together as it can cause death and chronic diseases. This is due to the fact that it involves people of all ages, including children, adults, and even the elderly. So, obesity can diminish the overall quality of life. You may not able to do physical activities that you used to enjoy. You may avoid public places. People with obesity may even encounter discrimination. Maybe they said that they're not good looking or anything. This will make them depressed or uh, will uh, will make them more sad than before. So, obesity, as previously stated and mentioned, is a growing epidemic that threatens to deplete medical resources by increasing the prevalence of diabetes, heart disease, hypertension, and cancer. In fact, obesity is one of the leading causes of death and shortening of human lifespan. as a result of disease complications caused by this issue. So as a result, all parties should work together to prevent this problem from recurring in order to maintain a healthy, intelligent, and active society ourselves together. So please take all of this info here with a grain of salt and refer to the experts and your doctor on which is one that fits with your condition. So all in all, I would say stay safe and stay healthy.
That's all from us.
Thank you.